And I'm going to start recording the webinar. I'm going to drop in the chat. We have a live captioner today, but I'm also going to drop in the chat how you can access the stream text. And so that is available for you as well. And my name is Hillary Ritt. I am the Adult Services and Workforce Librarian at the Kentucky Department for Libraries and Archives. I'm pleased to welcome you today to the Kentucky Moms MATR, Maternal Assistance Towards Recovery webinar, and I will introduce the presenter. Katie Stratton is the Program Administrator for Kentucky Moms Maternal Assistance Towards Recovery, or Kentucky Moms MATR, and she is going to be presenting here for us. I'm going to go on and actually turn over the slides to her and let her speak. The webinar is being recorded. It'll be made available within a few days. Also, there are several resources that are available in the Blackboard course, including a map of the Kentucky Moms MATR regions, contact information, and referral forms. So you please go in and access those in addition to the slides. So I will.
This is Amy, and I'm the Youth Services Coordinator. So I will turn over the whole webinar that we have over to Katie. And so Katie can introduce herself, and then her colleagues will probably step in as too. And again, we thank you all for being here with us today, and we look forward to learning from all that we're about to hear. Thank you, Katie, and take it away.
Hi, I'm Katie Stratton, and I do have some colleagues that are supposed to be popping in. I'm not sure if they're having some difficulty, but Elise is here with me as well. She's our prevention specialist. Mercedes Hilton is a case manager.
I'm having trouble with my audio. I can't hear anything.
Okay. Was that Elise?
No, my audio is fine.
Okay.
If you've got any questions or have an audio, please type those in the chat, and we'll be glad to assist you as best as we can. If you also are having any trouble, try and log out and come back in. You can also use the phone option, so call in.
Okay. And then our fourth person that will be with me, including myself today, is Jessica Osborne, and she is our Plan of Safe Care Coordinator for the Lexington region. So I will get started, and then I will switch over as needed. And if for any reason Mercedes is not able to hop on, I will just pick up her place. So at the beginning of COVID, everything shut down, and we decided to kind of regroup here at Kentucky Moms and decide, you know, what is our program, what is our mission, and this is the mission statement we come up. So Kentucky Moms is a behavioral health prevention and case management program focused on risks and effects of substance use or misuse, while providing education, information, resources, support, and hope to pregnant and postpartum individuals and their families, and to the professionals who serve them. So we also came up with a vision. I'm going to just kind of bounce with this one because there's a lot to read on the screen, but you guys also have this in your, can download this in the PowerPoint. We're dedicated to connecting pregnant and postpartum individuals and their families. We're dedicated to connecting and educating professionals in Kentucky. We aim to increase overall awareness and reduce the stigma surrounding prenatal and postpartum substance use or misuse. And through prevention, education, and case management services, we provide information, resources, and supports to pregnant and postpartum individuals and their families. And we are working in partnerships with community partners, organizations, and agencies, and we aim to strengthen that support network for our communities. So our values are, we strive to find ways to empower pregnant and postpartum individuals and their families to live healthier lives for themselves. We complement the existing resources and collaborate with other agencies and partners in our community. We listen, anticipate, respond to the changing needs of pregnant and postpartum individuals and their families in our communities. And we provide support to all pregnant and postpartum individuals and their families, regardless of their age, gender, race, ethnicity, background, religion, or philosophy.
Katie, I'm going to stop sharing your slide, and we're going to share the this video.
Okay, so this is a commercial that was created by New Vista. In the beginning of COVID, as I said, we had to find a way to really connect with our communities again. Everybody went virtual, and we were no longer allowed to come into medical facilities because of the restrictions. So this is a video that New Vista created, and other regions also have adapted this video for their region. But because we have Mercedes and Elise and Jessica on, we decided to share their video today since they were the creators. So for each region, they will have a voiceover that talks about the services that they offer and how to contact them. So you may see that, that's the base of our video that is on social media, and has been also placed on some local news agencies as well. So you're probably wondering who we are and what we do. We went over some of our mission statements and our values. But we are we serve pregnant and postpartum individuals up to 60 days. We are a substance use prevention and case management program that educates and assists with needs of those clients. And they may present with no substance use risk factors, they're just pregnant, all the way up to our mom may have a substance use disorder. So we see all pregnant women for that large array of services. We can see them anytime during pregnancy and during that 60 days postpartum, because right now that's when Medicaid stops paying for services. So once there is a bill out there to extend Medicaid's time frame to pay for postpartum services. So once that happens, our program will also expand. The programs are housed within our 14 community mental health centers. So those are, you may know them as Comp Care. So we have 14 of those around the Kentucky in all 14 regions. So every county in Kentucky has a Kentucky Moms representative. We receive referrals through self-referrals through the client, through anyone in the community, through behavioral health, through medical providers, through librarians. Anyone can make a referral to Kentucky Moms. So there's no limitations, no barriers to get people into our program. And we do all ages. So anyone in childbearing age that's pregnant. So we can serve teenage moms as well. So these are some experiences of our moms. So ACE scores are adverse childhood experiences. So the clients that we get that are before birth experienced, these are our percentages. So an adverse childhood experience can be very traumatic things in life that mold us into who we are as we're an adult. So they could be divorced parents, they could be childhood trauma, it could be abuse, neglect, bullying, substance use, generational substance use, mental health concerns. There's a large list, and it could also be environmental traumas as well. So as you can see, individuals who entered our program before birth, some had, 5% or so, 5.5% had no adverse childhood experiences they reported. But as we go up the number here, you can have, it's 1 to 10. And as you can see, most of our moms experience anywhere from 1 to 9 traumatic childhood experiences. So of the moms that entered our program after birth, a lot of times those moms come to us and are referred right at delivery. And that is because that's when the baby sometimes has tested positive during birth for a substance, or mom has tested positive at birth for a substance. So those ACE scores are typically going to be a little bit higher because their risk factor is already going to be higher. So of that population, when you look at numbers 1 through 9, that is our largest population. But you can see here that of the afterbirth moms that were referred, almost 14% of them had 10 or more adverse childhood experiences. So our moms are experiencing very traumatic things in their childhood all the way up to adulthood. These are the childhood risk factors. They're a little small on the screen, but it breaks it down into household substance abuse is in your first column on the top one here. Parents separated, divorced, mental illness, witness intimate partner violence, household member incarcerated, physical neglect, sexual abuse, physical maltreatment, emotional maltreatment, and emotional neglect. So this kind of just gives you a visual on the specific 10 things that we ask for when it comes to those ACE scores. So as you can see, a lot of our families come from a divorced family to begin with, but 65%, almost 66% almost, are generational child substance abuse. Victimization experiences in individuals before and after birth. So our highest one is assaulted or attacked by someone. So that was ever. The first column, the dark blue, is ever. And the light blue is 6 months before pregnancy. So after birth, you can still see before and after birth is very close of assaulted or attacked by someone. You can also see our sexual assault's pretty high, or intimate partner violence is also very high. These are rating of stressful events before and after in our clients. So before birth means that they were referred to us before the baby was born. After birth, again, is after the baby was born. And financial worries is number 1 there, over 50%. And then it changes a little bit because, the needs of the baby do change. So before it was childcare was a worry, lack of sleep was a worry, but that lack of sleep jumps up there. And it's almost, well, it is even with problems with DCBS, Child Protection Services, because typically that after birth column, they're referred to us because of substance use was determined at delivery. So I'm going to hand this over to Elise, and she's going to talk to us about prevention education services.
Hi, my name is Elise Coonrod. Sorry, I'm losing my voice, but I am the Kentucky Moms Prevention Specialist with New Vista, and part of my role is to implement education. So we have at New Vista, we call them educational baby showers. They are called different things at each um, RPC, and it's just determined for the Kentucky Moms Prevention Specialist what they want to call it. But at those baby showers, we talk about how different substances or how domestic violence or postpartum, how all of those things can affect you during and after pregnancy. And so we kind of talk about different things that they can do to lower that risk or to also moderate that risk of using substances, and or how to prevent from being in a domestic violence situation or having severe postpartum periods. And so we help with coping with those. But with along with that, we also give out different resources of different agencies that is also able to help out with whatever their needs are. And so I would do like little resource fairs for the mom as well to come and just to learn about the different agencies within their counties and what they can offer. So to be in prevention, like Katie said, you do not have to have a substance use disorder because we are trying to educate on how to prevent from having that substance use disorder. Um, do I have control of this PowerPoint now?
I can advance for you, Elise.
Oh, okay.
Here you go.
So we have three different education levels. So there's the universal, and that is just for everyone that is pregnant or postpartum up to 60 days. And so they are not at, or they indicate that they don't have an alcohol or drug use. Or with a psychiatric or medical condition, or present with biological, psychological, or social factors to increase the risk of alcohol, tobacco, or other substances. And so that's just generalized over everyone that is pregnant. But then when we do selective, those are for people who have indicated no alcohol or drug use within the last 30 days during pregnancy. And so those things really align with different ACE factors, like what Katie was talking about. And I'm so sorry. So that's like if they had a family history of substance use, or if a member in the household may also struggle with a substance use disorder, they have a history of emotional or sexual or physical abuse, or a history of mental health problems and diagnosis. So right now, I have a lot of clientele that is teen moms, and they automatically kind of fall into the selective parameters of our clientele. And then indicated is a pregnant or postpartum individual who present with the following. So they currently or has used alcohol or drugs. They exhibited problematic behaviors prior to pregnancy with substance use, or they currently or have exhibited risk factors that increase the chances of developing a substance use disorder. And so within those three categories, we have different educational programs that we offer. So for the universal, we have our universal baby shower, which is a broad thing and it covers everything. And then the selective, that's where we tailor it more to what the mom is in need of to educate her more about that. And then indicated is where we really dive in about why she may feel the need to use, or how she can cope with her different emotional problems or substance use.
So
Okay,
that
hi.
was Elise with prevention, and I'm going to hand it over now to Mercedes. She is our case management specialist.
Hi, everybody. My name is Mercedes Houghton. I'm one of the Kentucky Mom case managers. I'm located at New Vista. I work with Elise. So just talking about what Kentucky Mom's case management is. So case manager, the role is basically to help the mom with what's going on, supporting her, connecting her to resources, reducing those ACE scores, connecting the mom into any type of treatment that she is eligible for, all while supporting her while she's struggling with a substance use issue. To work with the Kentucky Moms case manager, the client has to have a diagnosis, some sort of substance use disorder. It could be mild, moderate, or severe. And they also have to be pregnant or postpartum. So a little bit about Kentucky Moms case management. They do not have to be in therapy to work with us. Usually the mom will get some sort of substance use assessment before working with the case manager, just so they can diagnose exactly what's going on and what sort of substance use issue that the mom has, and we can just best help the mom in her treatment. We do encourage moms to go to treatment if that is what they're appropriate for, but they don't have to be in treatment to work with Kentucky Moms case manager. We offer services, wherever the client's at. Some of our regions may be doing, still doing Zoom and telehealth services. I think some may be actually meeting in the home. I think it just depends on the region, but right now at New Vista, we're doing Zoom calls, telephone calls, or meeting with the mom if they would like that. If they would prefer to meet in person, we can definitely arrange that. And really what we do is just connect them to resources. So if the mom needs help with housing or employment or furthering their education, if they have an open DCBS case and they've lost custody of their child or under an investigation, we can help them and support them with connecting them to parenting classes, or some of them need help with getting domestic violence, anger management classes, things like that. So we're really working with the mom on exactly what the goals are, what exactly she wants to achieve. A lot of us are trained in trauma-informed care, so we utilize a lot of the evidence-based practices. So we client-centered care and motivational interviewing, just different things like that. And just really being an advocate for the mom. A lot of them are dealing with a lot of stigma of substance use. There's a lot of shame and guilt surrounded around substance use during pregnancy and postpartum. So we're just there to help them and support them and just really connect them to the resources. We're not clinicians. We are just case managers. So our job is just to support and advocate and connect the client. You can go to the next slide. There you go. Katie, did you want me to do this slide too?
That's fine if you want to.
Okay, so a little bit about harm reduction in Kentucky Moms. So reduction of harm, that's basically evidenced by we're reducing the use of alcohol, tobacco, and other substances. We're looking at the risk factors for substance use, and we're trying to reduce those risk factors. So a lot of that can be determined by healthy birth outcomes. So we look at low birth weight when the baby's born. That's usually a sign of something may be going on with some sort of substance use that can cause that, or the length of gestation, so how long their pregnancy is, if they're having their baby really early, not going full term. APGAR score, so that's the score that they score the baby once the baby's delivered. They look at things like the baby's breathing and the breathing rate, if the baby's crying, and just different things like that to determine their health when they're delivered. And they compare that to the general population of women and demographically comparable women. And we engage the women that are considered high risk. So like Elise was talking about, she's engaging those women that are considered high risk in the services that they need, and just really really connecting them and promoting positive behaviors and really getting away from the negative behaviors. So we want to, our goal is to improve outcomes of mom and baby during and after birth. So we're really focusing on that. A lot of what we do too is motivational incentives, which we call contingency management. So most of the regions do this, and we can help with baby supplies like diapers, car seats, strollers, baby clothes, bottles, sometimes gift cards, different things like that. So we really want them to achieve their goals, and we promote all those positive behaviors, and we're able to help with the incentives as part of that. So that really helps the moms want to actually do good and achieve goals when they know they can get a free item and get help with a car seat and just different things like that. This is actually our example of a reward sheet. As you can see, all the different baby supplies on there. And I know a lot of the regions do it a little bit differently, but at New Vista, we base it on if the client is going to their meetings, like meeting with case manager, meeting with their therapist, they're going to support groups, they're achieving whatever goal that they had in mind at the beginning of working with us, and they're actually doing what they're supposed to do. And we base it on points, a point system. So if they do a survey, they get 10 points, or if they do a treatment plan, they get 20 points, just different things like that, for example. And if they're compliant with that, they can rack in points, and they can start to get all the free stuff. So
I'll jump back in and go over some of the outcomes. So as part of our case management program, we partner with UK Center for Alcohol and Drug Research, and we have our clients complete what we call a baseline report. That baseline is done at the very first 3 appointments that they have with our case managers, and we ask them a wide variety of questions about things they have experienced in their life. To be able to determine their quality of life, their mental health status, when they enter the program, and then where they are when they complete their goals with us or discharge from our program. So at baseline, so as soon as they enter our program, 73% of our moms, and this is last year's data, we're a year behind on data. So last year's data said 73% of our moms reported illegal substance use when they entered our program. 8% at follow-up reported illegal substance use. So you can see that's a drastic drop within our program. Same with alcohol, 39%, 12% at follow-up. And our follow-up is 6 months and 12 months. So we do a 6-month follow-up after they leave our program, and then we do an additional, we do an annual follow-up after they leave our program. We do provide incentives for following up with us. It is completely anonymous, so we don't know who our clients are that are reporting any of this. So that's how we're able to get really good questions and responses at follow-up, is because our moms know that, we can't report them, their name's not taken down, that kind of thing. So a few years ago, we started really looking for mental health concerns in our families, and started looking at depression and generalized anxiety. One of the things that we work with our moms is on postpartum depression. So at baseline, we want to kind of see where they are prior to delivery. And 65% of our moms said that they experienced depression or anxiety in their regular everyday life, or they met criteria for that. They just hadn't been diagnosed yet. And 15% at follow-up still reported some symptoms of depression or anxiety. Intimate partner abuse has risen over the years due to economic struggles. So we saw for the first time, 42% was pretty high for us. At follow-up, 4%. We are seeing that at that 6 months, that intimate partner abuse is on the rise again at the 6 months to annual follow-up. Average number of days mental health was not good. Most moms reported 7.5 out of 10, and at follow-up they reported 3.8. Screen positive for post-traumatic stress disorder. Often this is related to intimate partner violence, ACE scores from their past, and 32% reported or screened positive for symptoms related to post-traumatic stress. This doesn't mean that they've actually been diagnosed, but they have symptoms related to that. 62% last year of our moms were unemployed. That was not unusually high. That's kind of right around what we're seeing before COVID years. So you would think that that would be kind of high in general and relate to our economic unemployment last year, but a lot of our moms, due to pregnancy, they're automatic, they choose not to work. And it's the same at follow-up. 35% we're choosing not to work in a lot of situations because of taking care of the baby at follow-up. Cigarette smoking, 80%, 60% at follow-up. I'm going to be honest and say this has been our hardest risk factor to break for many years. We have tried to get this lower than 60%. And I want to say 1 year since 1994 where we're able to get it down to the 40%, but it's been very, very difficult. And vaping makes that even worse because of the uneducation put out there, the lack of education around vaping. A lot of our moms think it's a safe alternative. And recently, within the last 2 years, we have developed some education material for our moms around that as well. So these are our birth outcomes. And as Mercedes stated, our goal is to have positive birth outcomes, reduce risk factors for our moms. So our moms averaged 11.4 visits to their OB while they were within treatment with us. We only had 11% of complications. 90% of our moms are on Medicaid. Most of our moms made it to 38.5 weeks on average. 80% of our moms are breastfeeding. We had 0 birth defects that could be detected at birth. On average, a 9 APGAR score. And the birth weight was a little lower than national average of 6 pounds, 13 ounces. But overall, our babies are being born healthy, and they compare right in there with someone who is in the general population that does not experience substance use or have substance use risk factors. So throughout Kentucky Moms, throughout the state, we've decided that we wanted to try to help our moms in other areas than just providing prevention education and case management, because we noticed some of our moms were needing things that we as a program could help them. We could help provide them. So each region had the option of creating a special project over the last couple years. And the most common special project is what we call our Kentucky Mom Sheds or baby sheds, just depending on the region. So in the Life Skills region in Bowling Green, and Amber is on our call today, they have Kentucky Moms Sheds, and I want to say they're up to 5 now. And I believe Pennyroyal region is up to 4 in their area. But in those sheds or in those baby sheds are items specifically for pregnant and postpartum moms. And we do have some baby items in there as well. But we are also providing things that WIC doesn't provide. So we're providing things like nursing bras. We have some postpartum hygiene products in there. We have name brand products that mom may need to take with her to the hospital. We do have nutritional items in there, some canned goods. We do offer bottles, nursing accessories, just things that we know that our moms will need. And these have been very popular. Oh, Amber just says they now have 6 and they're getting ready to add 1 more. So they have partnered with people in their community partners, to set up these baby sheds. So there's most likely a couple more across the state. This is a project that's been very successful and I see it growing. So if you're a library that would like to have a baby shed or a Kentucky Mom shed on your property, our staff stocks it completely, and your library staff are not responsible for it at all. All it is just a piece of ground where we can set a resource for our community members on. We maintain it, make sure it's in good condition. And it looks like Penny Roll's in the process, but they've not 100% gone live yet. In the Lexington area, one of their special projects was they wanted to expand prevention education to our Spanish-speaking populations. And that has grown so much that they're looking to add a second Spanish-speaking person to their team to offer that. Not all areas, they're the only one that has bilingual services right now in Kentucky. Pathways, the Ashland area, has the Greenhouse Project. This is a nutritional-based project to help moms learn how to grow food and to decrease food insecurity in their region. Some of our moms do qualify for WIC and food stamps, but transportation is often a huge problem. So if we can teach them to grow food at home, then we can decrease that food insecurity, because they will have the ability to grow food, can food, and have it on in their home if they have the inability to get to town. Oh, and Four Rivers, which is, they put in the chat that they also have a baby shed in progress. So North Key also is offering a community-wide baby shower, which is also, there's one coming up in the Life Skills region, a community-wide baby shower with multiple community partners that are getting together to provide moms in the region with pregnancy and postpartum necessities and resources. Life Skills says they have 40 vendors. And CommuniCare also has 4 community-wide events planned. They put those in the chat as well. So now I'm going to hand over to Jessica. And Jessica's going to share a little bit about our recovery-oriented system of care, which is also known as Plan a Safe Care in Kentucky, and how that got started.
Hi, everyone. So I just wanted to share with you a little bit about what my role is, and this is something that's offered in many of the different regions throughout the state. So Plan of Safe Care came about because Kentucky, we've recognized through the state that mothers often have, women can have different experiences throughout their pregnancy as far as substance use. So we just want to make sure that no women or families are falling through the cracks. So there are women who can be prescribed opiate medications for chronic pain or on medication, and they can later on have withdrawal symptoms. But those people may not necessarily have a substance use disorder. Another group of women may be receiving medication-assisted treatment. They generally do have an opioid use disorder or actively engaged in treatment for their substance use disorder. And then the final group are those who are misusing prescription drugs or using legal or illegal drugs and meet the criteria for substance use disorder. And are not actively engaged in any kind of treatment programs. So one thing that a lot of our different regions do is just trying to help connect community partners. So within our region, we have a meeting on the 4th Friday of every month where a lot of different partners throughout the community in all different areas come to just talk about their own resources that they offer, and we also do case studies where we can talk about a specific client that someone has, and everybody just pitches in ideas and tries to wrap around that person to make sure that we are providing all of the services that are available to them. And then this is the plan of safe care contact information for each different region.
So these are a list of the trainings that are offered by each region offers a mix of these. So if you have any staff that you would like to participate in these trainings, you can contact me, and I can put my my email address will be available at the end of the presentation. But the youth mental health and first aid and adult mental health and first aid, you do not need to be licensed or certified in any way to participate in any of those trainings. The same with QPR and SBIRT. Those are available to all community members, along with substance use during pregnancy and postpartum. That is also something that's available to all community members. This is our pregnancy behavioral risk screening. So this is a tool that we use. We often call it a level 1. It helps us determine the criteria for our program. So when we receive a client, we go through this questionnaire with them. It's based off the 4 Ps, which is an evidence-based practice. We've developed it to ask those questions. Doctors' offices can use this, and it also has a script on the back of it, and for SBIRT, which is a screening script that you can use when talking with your clients or your consumers. And when the specific questions are asked, we know where they would be a best fit within our program. There's a place for diagnosis if it's coming from a medical provider, and then they can sign and provide their information where we can keep in contact with them. We have a general referral that you can use as well for Kentucky Moms. There's also a place for the doctor's office to sign this. If you're not a doctor's office and you're making a referral, you're welcome just to leave those areas blank. We also do voice referrals through the phone or through email. It doesn't have to be officially on this form. It's just kind of helps out when we need a diagnosis from a doctor or something like that, and streamlines the process a little bit. But we take referrals in any form. In fact, I think I've forwarded out multiple within the last few weeks just by email. Someone just shot me an email and said, hey, I have this person who would be great for your program. This is our statewide contract list. These are the phone numbers, names, and email for every person in across the state, one in each region. So if you are in any of these counties and you have someone that has come up to you and is looking for services, and you notice they're pregnant, you are welcome to refer them to the person that's connected to your region, and they will do the screening to determine if they actually qualify for our program. We're okay with you guys referring anyone, even if you don't know they meet the criteria, because we have such connections in our communities, and I'm getting ready to jump back to Jessica to show you how we connect with our communities, but we connect with them so much that if they don't meet our criteria, we know somewhere else most likely that we can refer them or connect them with in their community. So we have Four Rivers Behavioral Health with Cynthia Turner, Penny Royal Center. Chris Sparks is on here, but we have a different representative from their region on our call today. River Valley Behavioral Health with Brooke Arnold. Life Skills is Amy Hutchinson, but we have Amber Sykes on the call today as their representative. Communicare with Amanda Clark, who's also on our call today. Seven County Services, we have Emily Kleinfelter, who is also on the call today. North Key Community Care, we have Autumn Smith, who is on our call today. We have Comprehend with Tara Anderson. They were not able to make it today due to prior commitments. Pathways with Kalonda Cade. Mountain Comprehensive Care with Taylor Trout. Kentucky River, we have Jamie Mullen Smith. Cumberland River Behavioral Health is Jill Owens. Sherry Estes with the Adonta Group, and New Vista with Mercedes is our main contact. And then we also have a sister program, which is called Project Link in the Louisville area. They are under the umbrella of Kentucky Moms. The only difference is 7 counties has where they have so many people within the city, and they have a city-specific person under Project Link, and then a county or rural area person under Kentucky Moms. So it's the same program. They do the same things. It's just different names because of the way it's differentiated within the city for them. So back to Jessica.
Hi, so this slide just kind of describes a little bit about what Plan of Safe Care is. SAMHSA defines it as a community safety net for the infants and families suffering from substance use disorder. It occurs at community level as a safety net, and like I said before, is designed to help prevent families from falling through the cracks. And communities must collaboratively develop a response that addresses the needs of infants and mothers and their families. So, like I said, the goal of it is just to make sure that all community partners are actively collaborating with one another and aware of each other's services to make sure that the families are receiving all of the potential services that they would benefit from. And do you have the other one on here, Katie? Yeah. So this one just kind of shows you all of the potential types of services that our families could be in contact with. So you have everyone on here, you know, from like DCBS workers, community support services, the school system, their employers, legal. So we just try to encourage everyone to collaborate across all of those different systems to make sure that everyone is working toward the same common goals for the family, so to make sure that they're receiving all the services that they need.
So this is all of our contact information. And we are accepting questions, and we do have representatives from most of the regions on the call. So if you have a region-specific question, go ahead and ask, because most likely we have someone that can answer it for you today.
Thank you all very much for your presentation, and I've got some questions, but I look forward to hearing what the audience members have. Please feel free to type your questions in the chat too. One of my questions, I guess, as I'm waiting for folks to get in the chat, you mentioned the resource fairs, and what's the procedure if a library wants to have a table or to have information at one of these resource fairs? And how can libraries find out about the fairs too?
So the most common way to find out is to get put onto their distribution list. We have the map there. So I would contact the regional contact and let them know that you would like to present the services that your library offers or have a table in any of the resource fairs they have open. And then they also often send out newsletters or information from the Regional Prevention Center. A lot of times we email out trainings that's for most of the time they're free trainings. And then we also offer a lot of times the ability just to include your information to our distribution list as well. So I would just contact them directly on the service map and just let them know you want to be on there. I know that there's also the opportunity, we do those prevention education baby showers that Elise was talking about. A lot of times our regions have little 4 to 5 minute slots, either in a virtual platform or an in-person platform, at those trainings as well. So those are a little bit different than our community-wide programmings. Those are more specific to when they offer services. So those are two different opportunities for you guys to get in front of an audience as well.
That's great. Thank you. The baby sheds or the hygiene, the mom sheds, would libraries be able to, it sounds like they could host them if they were wanting to, but even if they weren't able to host it on their site, could they work with the coordinator in that region to have information about story times and other resources that the library offers? Could they potentially partner with you to offer those resources in the sheds?
I'm going to say yes, but if someone that has a shed would like to speak on that.
Inside of our sheds, we have 6, about to have 7, and inside there is a like laminated type sheet that has like a list of resources, and then it says like take a photo and reach out for these. But we also have like brochure holders in it that do have multiple things of resources in there. So like the ones that are at the shed that's at Community Action always puts like pamphlets and stuff in there. And the one that's at Hope Pregnancy Center, they put pamphlets in there. So it's not like it's like closed to you all putting stuff in it. You are more than welcome to put stuff in it. We have lots of volunteer groups that will come and put stuff in it. Like it's very open for resources or things that moms can need, for sure.
Great. Any other questions, folks? In the chat, feel free to. And then Amy, my colleague, I'm so glad she introduced herself. Any questions you have, Amy, that I've missed? Thank you, Caitlin.
I really didn't have any extra. You guys did such a great and thorough job that I suspect things might bubble up as people put all that you've mentioned into practice or try to make connections, but that could be something we address at a later date too, because you've so generously offered your contact information and the potentials of ongoing partnerships.
Yes, that would be great. One thing that, and I keep saying since COVID restrictions happened, but that really changed our world a little bit, and I didn't get to really say a whole lot about that in the beginning, but before COVID restrictions, a lot of our staff were going into hospitals and going on rounds with doctors. We had a time we were going into doctors' offices and signing up clients or patients. We were meeting in lobbies, and when COVID restrictions hit, we lost all of that. So we went from like 100% in medical facilities to now we're down to like less than 10% in medical facilities. So we had to really restructure on how we do things, and we're still kind of struggling with that a little bit. So if any of the libraries are open and would like to be a resource place for us to be able to hold those prevention education classes, we would love that. And we could even work with you guys on maybe developing some type of a craft or activity with the kids that are going to come, because a lot of times moms come with kids in tow. So if there is a way to do like a corresponding kids activity, story time with those education classes, that would be awesome.
And I see that Rachel has her hand raised. Thank you, Katie, for that. Rachel, would you like me to unmute you?
Yes.
Okay.
I wasn't sure I couldn't get the chat to come up, so I thought I'd just raise my hand. But my question is, what are some ways that you could give that we could reach out to these mothers? We usually have like a regular crowd that comes to story time, and even though like we have a crisis center near us and everything, it seems like we don't really get those mothers to come in. And I don't know, I just wish that there were some ways that we could find, you know, people that are in, you know, can't think of the word, in jeopardy of, you know, being under
They need a
substance
little
abuse.
extra support.
Yeah, that might need more support. Like, what are some ways we can find those women and get them in our doors?
If there's any Kentucky moms that would like to open up maybe some things that they do.
I'll say this. Attending the baby showers, like Katie said earlier, we have sometimes 4 to 5 minute slots for community partners. So how I do it, I host a virtual baby shower once a month, where we have anywhere between 20 to 50 moms that's registered to sign up to attend it. And I send out to my community partners, hey, we have 5 slots. The first 5 gets it, because I have people fight for the slots. Let's put it that way. So I have that opportunity. So usually when community partners get on and they start talking about what they do, what they have going on, then they're able to go, oh, okay, that's awesome. And then they're able to give the moms that information about how to get there, what kind of resources, how to find it on the app, what's going on then, and so on. So I've had quite a few community partners tell me that they've gained access to more people in their community by attending these baby showers and just getting the word out to so many different mothers. So that's a really, really good way. And I do give my community partners the opportunity, just make sure you log on 10 minutes before your time slot if you can't come on the whole 2 hours, because sometimes 2 hours is a lot, but you can come on for 15, 20 minutes. But that is a really, really, really good way to try to get the word out there. And then also I do my moms get a Kentucky Moms packet, and it has all the resources and information and contact, all kinds of stuff. It's 70 pages long. And just making sure that, your library's information is in our resource packets and stuff like that we give to our moms. And I'm sure we all kind of have something like that. So just making sure we all kind of have something like that about the particular libraries in our regions.
Thank you. I'm see we're getting a little close to time. But Rachel has followed up. Do they have to become a member before they can attend a virtual baby shower?
So our virtual baby showers are available to anyone in the community. And when you, I'm going to answer this as they to be a client or a patient. We sign them up when they come. We get all of their information, because we do have to get a medical diagnosis for them to be with us. So we do ask them to complete a release of information for us to get that from their doctor. And if you're saying a member, as in someone that's part of our Plan of Safe Care community group, you're already a member of our team just by being in our community. So you can just contact us and let us know that you want to be part of that. And we will schedule you in for those baby showers, or you can still come to our Plan of Safe Care groups as well, or a ROSC group, as Jessica mentioned a minute ago. And you can be sitting at the table with, in one region, we have 30 different programs at the table, and we can let you communicate with all those 30 different programs as well, that you have all of these open services for the moms in the community.
Thank you all. We're having such great discussion. I'm going to have to, we're getting close to time, but I'm seeing some more stuff in the chat. I want to share, thank you, Rachel. I'm going to share our slide thanking the Institute for Museum and Library Services for sponsoring this. And I want to thank again the team at Kentucky Moms MATR. I have dropped in my contact information and my colleague Amy Olson's contact information in the chat, in addition to a survey that you all can participate in. Thank you for such informative information, and please don't hesitate to reach out to me or Amy, and we can get you connected with Katie. The information, the slides and the map and referral form are available in Blackboard, your course here, so you can access those. The session was recorded and it will be available in the next few days, but please don't hesitate to reach out to us at KDLA if we can connect you further, or certainly the map will have the contact information for that you can download and reach out to those in your region. Thank you all again, and thank you, Katie, Jessica, Elise, and Mercedes, and all the other staff who came from Kentucky Moms MATR across the state. I wish you all a great day, and don't hesitate to follow up if we can help you further. May you all have a great day. Yes, Amy has just put in there, if you come up with other ideas, please reach out.
Yes, and
Thank
if
you all
anyone
again.
wants to hold a community meeting with us, feel free just to reach out and we'll do just a regional meeting.
Thank you
Have
all
a great
again.
week.
You too. Thank you all.